One of the largest barriers to getting all this done is that every single implementation of electronic health records has been done in a slightly different way. And so the costs are not easy to roll. It's not easy to roll those costs up. Costs are, for instance, if you're looking at supply costs, cost for catheters, a heart catheter is very different than a urinary catheter. It's very different than a CV catheter. And if you're looking at catheters, you want to make sure that you're comparing apples to apples when you're doing that cost information. And even cost as simple as supplies, which you think you'd be able to add them up easily, that information isn't straightforward, let alone the cost that it takes to take a blood pressure or a cost of different levels of staff taking care of the same patients. So we're not able to pull those costs in a uniform way out of electronic health records to be able to analyze them in a uniform way and provide that feedback back. So that's where IT solutions have to come in to be able to do that and automate that process of cleaning up the data before it becomes usable. Sometimes it's hard to spend money on something as nebulous as data cleanup. And it's hard to share how messy that data is and help people understand it. Physicians really understand how messy that data is because and it's part of the struggle that they have with operational leaders. The operational leaders come in and say, here's your cost, it's bad, please try to make it go lower, right? And the physician said, that cost isn't even right. You're doing it you're lumping in things like patients who had bilateral knee replacements with a patient who had a single knee replacement. It's not an apples to apples comparison. And the physician is right. You know what? You need to be able to compare apples to apples. And so I think that hospital organizations are ready to be able to put money into cleaning that data up because they need to understand their costs at that granular level. I think that it's important that operational leaders within hospitals think about physicians as experts and think about physician decision making. And so when you're trying to marry that clinical perspective with operational perspective, you think about the physician as expert. They're doing their very best to provide excellent patient care. They weren't trained to think about cost. And so if the operational leaders can understand that physicians are experts doing the very best that they can based off of the training that they've received, keep that in mind, and then help provide physicians additional education about cost, I think that's a very important thing that will help bring both sides together. Some of the organizations have begun to at least examine the gap that exists, that physicians don't understand what the costs are of the care that they provide. So identifying that as the first step to being able to incorporate that and change the underlying structure of training for physicians. And then there are also grassroots efforts out there for training physicians about cost. And so I think those are another good step. And then having operational leaders within hospital organizations be willing to share that cost information with clinicians is the next thing that needs to happen, because that will get all the physicians that are currently practicing, not just those who are coming up in training. We need to have it happen faster than in 20 or 30 years.